One of the most common questions I get asked in terms of regenerative treatment or regenerative medicine is how long will the treatment last? This is Dr. Scott Nall from the Village Osteopath, so hang around after this intro and I'd be glad to answer it for you. Hey there, Dr. Scott Nall from the Village Osteopath. So the question I get asked frequently is how long will this regenerative treatment work? And when I say regenerative treatment, what I'm talking about is going to be either Prolotherapy or Prolozone, PRP, Platelet Rich Plasma, or one of our stem cell procedures. And these are mainly going to be used for, and this explanation is going to be dealing with musculoskeletal pain, mainly arthritis in the peripheral joints like knees or shoulders or elbows or ankles, or even in the spine. So that question itself probably isn't the best question in general. That question is kind of derived from the traditional pain model or the traditional medicine model of how we deal with musculoskeletal pain. In other words, let's just cover this up and then hopefully things will get better over time. But they're probably just going to keep getting worse and worse and worse, and we're just going to keep covering things up until eventually you have to get the joint replaced. That's kind of our traditional model, and if any of you have been to an orthopedic surgeon and talked to them about different treatment options, usually they're just going to say, yeah, we're going to try this out, but this is eventually going to have to be replaced in X number of years, or they'll say, well, you're too young for a replacement, let's just try to cover things up until we get you a little bit older when you can have a joint replacement. And so that's the most common way that we think about things when we're talking about treatments for joints. And with regenerative medicine, we need to start thinking of a new paradigm in that we're trying to regenerate the area. We're not trying to cover things up, we're trying to get the body to take care of itself. So that being said, how long does it last? It really kind of depends on how you respond and how you do. And so let's look at the way we normally talk about medicine in terms of, let's say, a knee. So if you end up with knee pain, you go into your orthopedic surgeon and they will say, well, let's do some steroid injections or cortisone injections they're going to give you. And what does cortisone do? Well, it's a very potent anti-inflammatory. And it's going to go into the joint, it's going to calm everything down, which sounds really good because the joint's inflamed, but the joint's inflamed for a reason. Joint's inflamed because either it's been damaged in some way, it has some type of instability issue, you might have a leg length discrepancy, it's causing extra weight to be put on it, might be something that you're eating. There's a lot of things that can cause joint inflammation. You might have some rheumatological disease that has been undiagnosed, or maybe it has been diagnosed. And so cooling it down definitely helps with pain. But it's not going to fix anything because whatever the underlying issue is still there. Or maybe the issue is already gone, but the joint has become so dysfunctional over time that just cooling it down is not going to do anything. You actually need your body to start regenerating the area and establishing normal physiology in the joint. And so, traditionally, orthopedic surgeons or your family practice doctor or sports medicine is going to say, well, we'll set you up for a series of these steroid injections. We're going to limit you to somewhere between 3 to 4 a year because we don't want to do too much damage in there. They say that because they don't want to tell you that it's actually destroying the cartilage you already have in the joint. And it's actually going to make it more difficult for them to do a replacement later, which I think is kind of odd. If you look at some of the research, if you have a replacement and you had steroid injections previously into the joint, your chances of having complications in the surgery go up astronomically. Even if you're going to get a replacement, probably opting not to get steroids is going to be a better choice than getting cortisone put in there. But I drew a little graph out over here to explain how regenerative treatments work in relation to cortisone or steroid shots. So if we look over here, I drew a timeline like this, okay, and we'll say this represents about 2 years, okay? And then over here we have a pain scale. So this is going to be time going out, and this is going to be low pain to high pain. And let's start up here, somewhere around a pain of about 5 out of 10, and you go in and you get your cortisone injection. And what's going to happen, over the next few days, you're going to get this nice cooling effect. You can kind of see here the pain level goes nice and down, and that usually lasts on average about 3 months on a good day. So if you happen to respond to cortisone really well, you're looking at probably about a 3 month, maybe even 6 months of good pain relief. And then the pain starts to creep back up, and will continue doing that unless you get another cortisone shot. And each time you get the cortisone shot, this pain dip you have is going to be less and less each time, and it's going to return to a higher level before. So over time, these quit working, and it makes the pain condition worse over time. But it's a great Band-Aid. Let's look at regenerative treatments. So regenerative treatments have a little bit different way they work. Some people will get actually a little bit of increased pain initially because the immune system is being activated, the body's trying to heal the area, and then you get this nice, slow, gradual decrease in pain over time. There's been some registry data to show that that slow regression in pain will continue for up to 2 years. So in other words, the day you got the shot, the pain will be less 1 year from now than it was when you received the shot, and will be even less than that 2 years from now. And it's because the body continues to be put into a regenerative state. Now, a lot of this has to do with whether or not you respond to the shots. Some of it has to do with, are you removing whatever it is that's causing the problem in the first place? So if it was just an injury that you had 20 years ago, then you've already removed it. You're not continuing to get injured, but there might be instability around there. So addressing that instability in the joint might be your next step to keep this from progressing. It could be that you've had meniscal surgery in the past and it's caused your knee to be loose. And your knee is now, instead of being straight, it's got an angle to it. And so you might need to be fitted for an unloader brace to help straighten the knee back out so that meniscus isn't getting pinched all the time. It could be that you're eating a highly inflammatory diet. Your whole body's inflamed, in which we need to address that. So there's a lot of issues that indicate how long regenerative treatments are going to last. But I can tell you, in general, about 75% of people do respond to regenerative treatments in some form or another. And out of that 75, somewhere around 90 to 95% of them people feel like it was worthwhile to have it done. So bottom line, before you start any kind of treatment, whether it be a regenerative treatment or any type of surgical or cortisone option, you have to ask yourself, what are my end goals? If your end goals are a long-term decrease in pain and an increase in function and getting back to the things you want to do on a long-term basis, regenerative treatments are right for you. If it's something that you just need a quick Band-Aid or a quick fix, for instance, like, yeah, I'm leaving for the Caribbean tomorrow and I just hurt my knee really bad, I need to be able to get through this, then maybe a steroid or even just flushing the joint out with some saline might be a good option to kind of get you going. But just remember that cortisone over long periods of time does not fix anything. It's mainly just trying to alleviate some pain so you can move on with your life for a short amount of time. Regenerative injections, if they are successful, should give you the long-term outcome that you're looking for. The next question is duration, or how long will it last? Well, with steroids, we can look into studies and look to see what is the half-life of that steroid. In other words, how long is that steroid going to hang around your body? And we can extrapolate how long it's going to last based upon that. Also, we have to know that whatever underlying issue you have going on, if that's still there, it's going to continue to cause the problem over time, and that dysfunctional joints going to continue to be dysfunctional. Now, with regenerative treatments, it really depends on what treatment you pick. And it's based upon the way your body heals. So all regenerative treatments are based upon trying to get the body to take care of itself. And your body has a natural regeneration capacity. We all know this because if we fall down and cut our arm or scrape our knee, we notice that scab forms on there, and then a week or two later that falls off and we have fresh new skin there. So we know that our body heals itself. Or if you ever had a big injury, you know it takes longer. And so that natural healing progression, as far as the way the body responds to injury, takes about 100 days. So in that time is when the body is producing growth factors and the body is producing messenger molecules to tell the body, hey, you need to repair, where the body is coming down. It's making sure things aren't getting infected. It's laying down new tissue. It's basically repairing itself from the inside out. So with regenerative treatments, there are a few different options. The first would be prolotherapy or prolozone. In prolotherapy and prolozone, what we're doing is we're trying to activate the body's immune system to start healing itself. We do this by initiating a very mild inflammatory solution into the area, which also activates a few different pain suppression receptors that we have called the TRP1 receptor. It's very similar to the one that capsaicin stimulates. And by doing this, the body is able to jumpstart the healing process and start moving again. Usually with prolotherapy and prolozone, we repeat the treatment about once a month, because at about 30 days out, you're able to restart that cascade again to get the body to start doing a new healing response. And we keep repeating it every 30 days or so until either you're pain-free or you've met the goal where you feel like you don't need to do it anymore. So your pain is decreased or your function has increased to a place where you feel it's acceptable. Otherwise, we just keep repeating until one of those conditions are met. When it comes to PRP, we repeat that procedure at about every 6 to 8 weeks. And the reason being is that it's just a more powerful one, and we're actually bringing the immune system to the area of issue. So unlike prolotherapy, where we're just stimulating the immune system has to come there. With PRP, we're actually bringing the immune system there. And so not only does it stimulate, it's also bringing those molecules directly to the point that's needed. And because of the way it works, most practitioners feel like somewhere between 6 to 8 weeks is a normal time to get this done. Does that mean you need to get done every 6 to 8 weeks for the rest of your life? No, it just means you need to do it until you feel like you've hit a plateau. In other words, it's not working anymore. Then we need to address, are we still treating the right area? Do we have an improper diagnosis? Or we need to say, hey, I feel pretty good. My pain level is an adequate amount or it's gone and I'm able to do the things I want to do, in which case we stop and we will repeat it whenever you feel like you need to. Or some people, if they haven't been able to eliminate or get rid of the thing that's causing the dysfunction in the first place, might have to have it done a few times a year. And then finally, we have stem cells. And stem cells, when those are administered, we always administer them with platelet rich plasma. And so it takes the healing effects even up to a higher level. So not only are we bringing the immune system to the area, we're also bringing cells that can then differentiate into the tissue needed. We're stimulating the immune system, we're bringing the immune system there, and we're bringing cells there. So all three of those is a great trifecta into the damaged area. And those, sometimes it can take out to 3 months before you even start to notice a difference for those because the healing process is so deep and powerful. And it will continue to have regenerative effects up to 2 years out that we know of. And that's if you're a responder. And like I said, about 75% of people do respond. And so when do we repeat that? Well, registry data from some clinics have shown that the time to repeat stem cell procedures would be somewhere between 9 to 12 months. And that seems to be the time where you're going to get the most benefit out of a repeat treatment if the first one didn't give you the effects that you needed the first time around. Now, after that second one is done, when do you need to have it repeated again? Once again, it could be you never have to have it done again. But there are some clinics who believe right now that the time frame is somewhere between every 3 to 4 years after your second injection. Or if you responded to the first one and you got where you wanted to go with that one, it would be after your first injection. So I hope this answered your questions. And if you have any more, feel free to email the office at info@villageosteopath.com. If you liked the video, please like and subscribe to the channel because we always need more subscribers. And please share it with your friends that might be having knee pain or shoulder pain or any other kind of pain that you think we might be able to help them out with. You can always visit us on our website at www.villageosteopath.com. We have a Facebook page that's pretty fun to get on, and we share these videos on there and also some other healthy life tips. So until next time, this is Dr. Scott Nall from the Village Osteopath, helping you restore your health and optimize your life.